Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of the Checkup. Leadership transitions are always present opportunities and challenges for organizations. But taking over a healthcare system in the middle of a pandemic, well, that's a whole new dynamic. I'm pleased to be joined today by Marty Bonick. He's the new CEO of Ardent Health Services, which operates 30 hospitals across 6 states. Marty took over as CEO of the Nashville-based company in mid-August. Marty, thank you so much for being with us today.
Thank you, Matt. Wonderful to be here with you today.
So there's a lot I want to unpack about your new leadership role at Ardent, but this is a bit of a homecoming for you, right? Because you kind of started your administrative career with a hospital that is now part of the system, correct?
That's exactly correct. 1997, I started with the Hillcrest Healthcare System in Tulsa, Oklahoma, and that was the beginning of my administrative career as an administrative resident. And in 2004, we became part of the Ardent Health System, and I had the privilege of working with the company for a few years before my career progressed and moved on. So to come back is a really special homecoming, as you said, to come back where you started and to see how this company has grown and flourished in the couple of decades that it's been around is impressive, and I'm looking forward to the next chapter of our history.
So as you think about that coming in, as I said at the outset, you're coming in the middle of unprecedented time here. And I do want to talk a little bit about how you've been able to reach out to your team, whether you've been doing most of that virtual or I understand you have been doing some travel. But first, what are some of your strategic priorities as you look at this coming in? You're now a couple months into the role. Did you have some very specific priorities that you wanted to lay out for the team going forward?
I did. As you said, coming into it during a pandemic, this is not the way that you would have written your ideal entry into an organization, but it is the situation we're all faced with, and I'm no different than anybody else in healthcare these days in terms of the challenges we face. But coming in, one of the things that I expressed to our team was trying to establish a sense of calm. And a motto that I had adopted early on was to respect the past, but to embrace the future. As I mentioned, Ardent's had a long and rich history, and it's great to see how the company has grown. But we're in a new evolution of healthcare, and healthcare is constantly in a state of change. And so while Ardent has a rich past, and we're going to build on the traditions and the culture that we have to realize that healthcare is changing, and that we have to change and evolve with that in order to be successful and relevant and sustainable for the long term. And so that is something that I've tried to embody here in my first 90 days, is to respect the past, but to help everybody understand the need to embrace the future.
Are there some specific things as you think about embracing the future? Were there some specific areas that you think need to be addressed?
Absolutely. We are first and foremost a hospital company, and that has been our roots and our history. But as we all know, healthcare is evolving. And our ability to go where the patients want to be versus having them come to us is important. Customers or patients and customers have choice these days, and we need to make sure that we're accessible in a method and a manner which is convenient and accessible to them. And so we have embraced digital technology and our digital front door. In addition to our emergency rooms and clinics, we're looking at other outpatient services that we provide in the community to make sure that we are providing timely and relevant healthcare accessible services for the patients where they need to be.
Certainly, that shift to outpatient has been going on for a bit of time. How has, though, the pandemic influenced or that shift? And as you think about going forward, what does it do to a strategic plan of more outpatient, less outpatient, telehealth?
Yeah. Well, certainly, I think all the hospitals were faced with the sudden shutdown of elective surgeries and services across most hospitals in the United States, and so that certainly knocked everybody backwards. And so when you have a plan, I think a lot of the plans went out the window, and survivability became goal number one, which our company has done quite well at from that perspective. But as the newcomer coming into the organization, I'm trying to find the silver lining as a result of what's happened. And I think one of the bright spots in this has been our ability to incorporate telehealth more deliberately into our care services offering, and how we embrace that technology as an example. Healthcare has been known to be slow and bureaucratic at times, and it takes forever to get something moving sometimes. But this is an impressive stat that our organization up to embrace something so quickly that's been around, but telehealth and telemedicine. We were doing virtually we were doing less than 1,000 telehealth visits a month across our company. And so while this technology has been around for a long time and many systems have had different types of experience with it, it was not a deliberate part of how we were engaging our patient base. If you look at the numbers, if you fast forward by the month of April, so a month into the pandemic, we were doing over 60,000 visits a month. And so we didn't have time for a committee or time for the typical, strategic planning and machinating that you would go through to launch something like that. But really impressed at our ability to be nimble when we need to. And as I say, we've all heard the 0 to 60 in a car. 0 to 60,000 is pretty impressive in healthcare, for any initiative, let alone in the timeline we had to do it. So I'm really looking at the silver lining of how our ability to engage with patients and where they need to be met can be done differently. And this is, telehealth is one example. Tele-ICU is another, and I think the strength of being part of a larger system and network is that our hospitals in New Jersey were at the front line when the pandemic first started. A lot of our other hospitals had capacity because of elective procedures being shut down or slowed down. And so we had team members that were able to travel to go and help our New Jersey hospitals out. At the same time, we set up tele-ICU services where our specialists and intensivists in our Tulsa market, for example, were able to provide services to our hospitals in New Jersey to help with that surge and overflow. And as a result of the learnings that we had there, we're able to continue those things into our other operations. So as the surge and the spread has migrated across the country, we're in a better position today because we have the opportunity through trial and error to work through those and now incorporate those as best practices across our company.
Yeah, I think that point of 0 to 60, as you say, is interesting. We've heard it from other folks and maybe that's something that holds on post-pandemic is you restructure some of your governance to be able to make some decisions that aren't turning a cruise liner in the ocean, but are more rapid.
Most definitely. And I think, we are seeing, like most hospitals, still a slowdown in our ER visits compared to historical averages and norms that we had seen prior. They are coming back, but not as nearly as quickly as surgeries and admissions have been across the system. And so as we think about the organization and key statistics that we follow and measure, telehealth visits, clinic visits, those are going to be important metric points to understand, are we truly connecting with our patients and engaging them where they're at, and making sure that, one, they feel safe to come back when they do need critical services, but we still have touch points with them, outside of that. And so I think, again, this is it's a wake-up call for the industry to really become more patient-centric in terms of meeting patients where their needs are and making sure we have relevant touch points with them and continued accessibility to services when they need them.
Right. And Marty, you alluded to the spike that we're seeing currently. We talk about it as the second wave. I'm not sure we ever really left the first wave, but what are you seeing in terms of being able to collaborate from your hospitals in New Jersey to Oklahoma to Texas to New Mexico that are really all having varying surges?
Yeah, while it started in New Jersey back in the early part of the pandemic, it has certainly spread across the country, and nearly every one of our hospital markets is seeing a significant spike in volumes. I don't think we're any different than any place else right now, but the benefit we have is we have all hands on deck meetings on a weekly basis where our leaders across the company and our physician leaders are able to get together to share best practices and lessons learned so that we don't have to repeat them times 30 in each one of our hospitals. And I think that's really one of the big strengths that we have as an organization. If you think about mass casualty events, there's an incident command structure and a process in which that works. And I'm just really impressed with our team's ability to create that structure, to keep the momentum going, and to be able to take tangible lessons learned and cascade them across the organization so that every hospital doesn't have to figure this out on their own. I've remarked as I've made some travels to our hospitals and trying to thank people for their service that, healthcare has always impressed me that in a time of need, people are able to quickly come together and drop their differences and drop the pretense and bureaucracy, and you see people's best come out. Oftentimes at times where our country or an environment is at the worst. But this pandemic has really stressed and challenged all of us that, typically those other types of events are 24, 48, 72 hours. This has been going on for months now, and there's no clear end in sight. And so as a leader, my goal is to thank our team for what they're doing and to encourage them to keep going, because we don't know the end of this. But what we can learn from each other and make sure that we're sharing and helping each other out to weather this storm as long as it may last is the important part to stay focused on.
Right, sure. And as you said, you've been traveling now, meeting some of your team members across the country. You're certainly not going to be the last CEO to move into a new role over during the pandemic. So as you think about your experiences, as other people transition to more leadership jobs, what are some of the experiences, best practices, lessons learned you've had over the past 2 months?
Yeah, I would say the first is, don't try to disrupt the incident command structure that's in place. I think that most hospitals have had to weather this storm at some level or capacity, and you have to trust your people and trust the process. As a new leader, one of my jobs is to question and to challenge. Are we thinking through this with a fresh set of eyes and making sure that we're doing it, but also not to second guess the good work that's happening. And so the best practices and the weekly calls that we have and the knowledge sharing and transfer across, that's not my job to question. It's to support the team and to empower them to make sure they have the resources to as issues are surfaced, that they can address those and confidently execute on them, and our people have the testing that they need, the protective equipment that they need, and the supporting resources and staffing help, when it becomes a problem or before it becomes a problem. And so it's to trust the process, support the team, and to be grateful. For me, getting out to the markets, while I wish I could have been to every hospital thus far, and I've gotten to a little over half of them, the pandemic has just slowed things down unavoidably. But to be out there, to walk the halls, to just say thank you to our team and acknowledge them for their efforts and continued support, again, as we don't know when this is going to end, is extremely important, and I think well received. That when the front line sees that our leaders are still engaged, supportive, and willing to walk the walk with them, I think makes a big difference.
Got it. Marty, I want to shift gears a little bit, and this certainly predates you, but earlier in the year, Ardent pulled back from an IPO that it was about to do. Do you have any plans to revisit that going into the end of this year or 2021?
I wouldn't put a timeline on it, but certainly that is in our long-range strategic planning. I'd say, if anything, it probably turned out to be a blessing this year that it didn't happen, as valuations across the industry have been a bit depressed. And so it was probably another silver lining to the pandemic that we decided not to move forward. But we do have plans in the future to continue to move on that journey, and we'll be making progress on that in the years to come.
And lastly, as you know, there's a lot of concern across the industry about the growth of private equity within healthcare. You are private equity backed. This concern about it being too profit driven. What's your thoughts about that, and what do you see in terms of the growth of private equity across healthcare?
Yeah, I've got maybe a little bit of a different twist that I would put on it. I have been fortunate in my career to work in private environments, public environments, for-profit, nonprofit, academic systems. At the end of the day, we're all here for one mission, and that's to take care of the patient. Regardless of our tax situation or our investor base, I've never worked in a hospital, nor would I, that doesn't prioritize our patients' needs and their quality and their safety at the front of everything that we do and what we stand for. At the end of the day, private equity is a means of financing investment into bringing together groups of hospitals and sharing best practices and leveraging size and scale to again share that knowledge, but also to continue to find ways to reduce the cost burden of delivering healthcare services efficiently. It's one of the biggest domestic agendas we have politically in the country, and we got to see that play out in the election here and still playing out. and it will be a top domestic agenda for years to come. And so we have, as healthcare leaders, have to find ways of delivering care with the utmost quality and safety, but also doing it at the most efficient way, because the reimbursement system can't keep up with the economic inflation that we've seen in the industry for the last couple of decades. And so we have to be smarter about it. And I think private equity is a means to help bring the best of hospitals together and bring those best practices together to leverage that across a greater platform than you can do in a single region.
Got it. Well, Marty, there's a lot that we could continue to talk about, obviously the election and other things. We'd love to be able to come back and check in with you, see how you're doing, another 90 days into your tenure there and beyond. But we appreciate you taking some time. We know it's extremely busy. So thank you for taking some time out with us today.
Absolutely. Wonderful to be with you today, Matt.
Thanks so much, and stay safe.
Thank you. You too.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.